If you go on Facebook, you've probably seen these ads for this supplement where they make claims such as 6,000 times stronger than vitamin C and 5,000 times stronger than other vitamins and all that stuff. This stuff is called astaxanthin. Astaxanthin, it's called. And what is this stuff? And is it any of use, or is it just more hype and garbage? Well, I first became interested in astaxanthin when I read that it can penetrate the brain barrier and thus protect the brain. Now, the brain is largely composed of polyunsaturated fats. For example, DHA, which is one of the two main omega-3 fatty acids, the other one being EPA. 40% of the fat in the brain is composed of DHA. The problem with that is that type of fat is polyunsaturated fat is highly prone to oxidation. And when the fats in the brain get oxidized, it promotes diseases such as Alzheimer's disease and Parkinson's disease. So anything that can get into the brain and maintain the stability of the polyunsaturated fat content of the brain would be very useful. So this particular property of astaxanthin, it's still tough to pronounce, caught my attention right away because I was aware of the polyunsaturated fat effect in the brain. You know how the brain fats can literally go rancid. That I was also intrigued to learn that astaxanthin seems to help protect the eyes when you have to stare at a computer screen for hours like I do every day, or whether you're doing writing like I do, or researching, or just surfing the net. Staring at those pixels, it actually takes a toll on your eyes, and it can cause tremendous eye fatigue. They've shown in studies that astaxanthin actually helps to protect against that, as does looking away from your computer about every 20 minutes and just kind of looking around the room, moving your eyes. This kind of takes the stress off the eye muscles. Rather than when you stare at something continually, you're more or less cramping the eye muscles and causing tremendous fatigue. So what you do is every 20 minutes, you want to just look around the room and get your eyes off the computer. This actually helps to relax the eye muscles. You should also, by the way, if you're doing a lot of sitting in front of the computer, this is just an aside, you want to get up every 20 minutes also and walk around, because constant sitting, especially more than 2 hours, is very, very bad for your health, very bad for your vascular system. I sometimes get so involved in my writing and my work that I forget to get out, but that's very bad. I try and remember. I'll pour myself another cup of coffee, something like that, move around. Even better is to hop on a stationary bike, do about 5-10 minutes of cycling, or just get up and do about 25 squats. The whole thing is to keep the blood circulating in your legs, and that's what prevents the vascular breakdown that occurs with extended sitting. But that's not the topic. I know I've gotten off here. So I looked into astaxanthin, and I found that it's far more potent than as an antioxidant compared to the more well-known antioxidants such as vitamin C and E. Now, astaxanthin is a carotenoid in the same chemical family as beta-carotene and lycopene. Unlike beta-carotene, though, astaxanthin cannot be converted into vitamin A. So it doesn't do that. It's produced by several freshwater and marine microorganisms, including bacteria, yeast, fungi, and microalgae, particularly microalgae, with the most dominant one being something called Hematococcus pluvialis, another jawbreaker. Because of its deep red-orange color, astaxanthin leaves a pink or red color in salmon, trout, lobster, shrimp, and other seafood that feed on these organisms, so like the microalgae. They feed on them, and that gets deposited in the seafood body, if you want to call it, and they get a reddish color. Astaxanthin is also responsible for the color of pink flamingos, which also feed on this type of microalgae. That's what makes them pink. Astaxanthin is 550 times more effective than vitamin E against lipid peroxidation in the mitochondria. Basically, that's fat in the mitochondria being adversely affected by free radicals, which are byproducts of oxygen metabolism. I don't want to go into all the biochemistry, but let's put it this way. Astaxanthin can help protect mitochondria, which is very important to health. It's also 6,000 times more potent than vitamin C as an antioxidant, 5 times more potent than beta-carotene, in quenching a type of free radical called singlet oxygen, which is produced a lot in low oxygen environments, very common, and it causes tremendous damage to your cells and cell membranes. Astaxanthin is a potent antioxidant, anti-inflammatory, providing protection against Alzheimer's disease, Parkinson's disease, amyotrophic ALS, or Lou Gehrig disease that Stephen Hawking had, many other brain diseases. It protects. It seems to offer some protection. Indeed, astaxanthin prevents the accumulation of a substance called phospholipid hydroperoxide, which accumulates abnormally in dementia patients. It's one of the things that causes the dementia to occur. In the brain, providing astaxanthin, it exhibited strong anti-inflammatory effects, suppressing the expression of inflammatory mediators such as tissue necrosis factor A, prostaglandin E2, and interleukin 1B, and blocking the production of nitric oxide and the NFKP-dependent signaling pathway. That's the master. NFKP is the master switch that turns on inflammation in the body. These findings validate astaxanthin administration as an adjuvant therapy for Alzheimer's disease, since this is from a medical journal I'm reading, by the way, since this carotenoid is able to attenuate microglial activation and the consequent release of pro-inflammatory cytokines. Now, the microglia are a portion of the brain that tend to release, when it gets out of control, it releases these inflammatory cytokines that cause tremendous damage, and the brain reacts by increasing substances such as beta amyloid protein. It also encourages the phosphorylation of tau, and the net effect is Alzheimer's disease. So anything that's going to kind of tame the microglia in the brain is going to help prevent brain degeneration, and that's what astaxanthin actually can do. This effect has positive repercussions on neuronal integrity, especially in elderly people who tend to show increased inflammation in the brain. Recent studies have reported on the direct relationship between the healthy effects of astaxanthin on human brain and promotion of neurogenesis and plasticity, two processes that significantly decrease with age and lead to cognitive decline among elderly people. Although, in other words, that's what that means in simple English is that astaxanthin can prevent processes in the brain that lead to what they call senior moments, brain fog, memory deficits. This is all caused by the degeneration of certain structures in the brain. Astaxanthin can help protect against that. Although the molecular process has not been completely elucidated, I like the way they write these medical journals. They try to make it as hard as possible to read. Astaxanthin promotes neurogenesis, which is the production of new neurons, and improves behavioral performance in the hippocampal dependent test. The hippocampus is the structure in the brain which is thought to be the seat of memory and learning in the brain. It's the part of the brain hit hardest by Alzheimer's disease, and that's why you get all those memory problems and severe brain deficits. This could represent the predominant mechanism induced by astaxanthin, acting on cognitive functions and neurodegeneration caused by Alzheimer's disease. Now, unlike other dietary antioxidants such as vitamin C, which are converted into pro-oxidants when they neutralize free radicals, astaxanthin remains stable. See, the problem with vitamin C and E is, as I said earlier, free radicals are unpaired electrons, and they do their dirty work by attaching onto electrons, which normally come in pairs. When they attach onto the normal electrons, they mess up the electrons. This can cause various health problems. Now, the way that the vitamin E and C does that is by donating an electron to a free radical. So now the free radical, instead of having one electron, has two, which makes it stable. But in donating one of the electrons, the vitamin C and E itself now becomes a free radical or a pro-oxidant. The difference between vitamin C and E and astaxanthin is that the astaxanthin does not remain stable. It's not converted into a pro-oxidant, unlike those. And I should also point out that vitamin E and C are readily converted back into antioxidants by other nutrients such as alpha lipoic acid, coenzyme Q. So it's no big deal, but it's something, it's something to think about. Astaxanthin can lower oxidative stress in smokers and in those who are obese. One of the problems with having too much body fat is increases oxidation in the body, out of control oxidation. This is what causes a lot of the damage associated with having too much body fat, because the oxidation leads to increased inflammation. So you get systemic inflammation, that leads to cardiovascular problems with the brain, and so on and so forth. Some studies suggest that astaxanthin can offer protection against cancer. A 2005 study found that it prevented the growth of breast cancer. There's not a lot of research on cancer related to astaxanthin, but again, oxidation is a component of cancer, so it makes sense that astaxanthin might have some protective effects in that regard. Astaxanthin can be used topically to promote healthy skin. A 2012 study showed that combining topical and oral doses of astaxanthin can help to smooth wrinkles, make age spots smaller, and help maintain skin moisture. When applied topically to the skin, like as a cream or something like that, it can prevent the changes in the skin that can lead to the development of skin cancer. Now, the way astaxanthin does that, when you have the ultraviolet rays, and when they react with skin cells, they can cause mutations in the DNA in the skin cells. Mutations in DNA is basically the beginning of cancer or tumor formation, and astaxanthin can basically absorb the energy from the UV rays and thus prevent the damage to the DNA and skin cells, and by doing so, it helps to prevent various types of skin cancer, basal cell, squamous cell, possibly even melanoma, which is the most fatal type of skin cancer. Studies conducted in Japan show that supplementing with 4 milligrams of astaxanthin per day leads to protection of the skin against UV rays. And supplementing with 6 milligrams leads to better skin texture, elasticity, and improved eye health. Related to exercise, astaxanthin appears to help increase exercise endurance and reduce fatigue levels following exercise. It also reduces lactate levels, and that's another reason why, lactic acid, it helps to relieve exercise fatigue. Mouse studies show that it does this by increasing the use of stored fat as a fuel source during exercise, which is what you want. When you work out, you want to use more fat and astaxanthin seems to help you do that. The dose for athletes and those involved in heavy training is 12 milligrams a day. Some people suggest up to 16. I do not. I think 16 milligrams and up is overkill, although the Food and Drug Administration has said that administration of supplemental astaxanthin at doses of up to 24 milligrams is safe, but I don't think you need that much. I think the maximum that anyone needs is 12 milligrams, and that's for those involved in, for example, heavy sports participation or intense training. For most people, 4 to 6 milligrams is enough. This stuff goes a long way. It can also protect the heart. A 2006 study that examined the effects of astaxanthin on rats with hypertension or high blood pressure showed that it helped to improve elastin levels. Elastin levels is a kind of connective tissue protein in the skin and in the smooth muscle that lines blood vessels. And it also, it not only improved the elastin levels, it also increased arterial wall thickness, which helps to prevent things like strokes and heart attacks. Other studies suggest that astaxanthin can help treat joint pain. It can also, it seems to help with a type of arthritis called rheumatoid arthritis. It can also favorably affect male fertility by increasing the health and movement of sperm. They've given astaxanthin to infertile men, and it actually helped make them fertile again. I'm not saying it's a cure for every man, but it seems to help in that regard. Since astaxanthin is a fat-soluble nutrient, it's best ingested with a meal containing some fat. You got to eat some fat with it for it to be absorbed. How much? A tablespoon of any type of oil, such as fish oil, extra virgin olive oil, or even MCT oil, would be enough to help absorb astaxanthin. Indeed, astaxanthin can help maintain the stability of fish oil, and prevent rancidity effects. I remember reading a study, I don't remember the source, years ago, where they said that if you add astaxanthin to fish oil that's already turned rancid, it will actually reconvert the rancid fish oil back into fresh fish oil. Again, this is a long time ago. I'm not really sure if that was proven to be true. That's one study showed that, though. Astaxanthin is also a natural inhibitor of 5-alpha reductase, which means it can help prevent 5-male pattern baldness. 5-alpha reductase is the enzyme that converts testosterone into dihydrotestosterone, or DHT. DHT is thought to be responsible for male pattern baldness. Drugs, a lot of men use drugs that inhibit 5-alpha reductase, such as finasteride or Propecia, to prevent male pattern baldness, hair loss. It turns out that astaxanthin is a natural inhibitor. I doubt that it's nearly as strong as the drugs, though, but it probably has some effect. And the reason for that is that the same enzyme that's used to metabolize aromatase also works with astaxanthin. To avoid, one thing you wanted to, in regard to supplements, one thing you want to do is try to avoid synthetic astaxanthin. That's made from petrochemicals. Instead, use supplements produced from natural sources, predominantly Haematococcus pluvialis algae. And I should say 95% of the supplements on the market, I'm talking about astaxanthin supplements, are synthetic, and they should be avoided. They're junk. Don't use them. You want to use only the natural forms produced from algae, that's a natural and safer form. One study showed in vitro studies conducted at Creighton University and Brunswick Laboratories showed that natural astaxanthin is over 50 times stronger than synthetic astaxanthin in singlet oxygen quenching, and is approximately 20 times stronger in free radical elimination. So natural is much more potent and much safer than the synthetic version. And the synthetic version has never been demonstrated to be safe for use as a human nutraceutical supplement. And they use it, what they use it for? They feed it to salmon, to farm salmon, to make the salmon look pink. It's actually used as a coloring for fish. That's what synthetic astaxanthin. You don't want to take that. You want to take the natural form. Now, as far as contraindications of people who should be careful about astaxanthin, if you're using any kind of blood thinning medication such as Coumadin, for example, if you have atrial fibrillation, which is a heart condition common in older people, they usually are prescribed blood thinners like warfarin or Coumadin, something like that. You want to avoid astaxanthin because it also thins the blood, and doing so, it can, if the blood gets too thin, you can get a different type of a stroke. Caution is also advised for those with diabetes or low blood glucose levels because astaxanthin can lower blood glucose levels. Now, on the other hand, I've ingested astaxanthin for years. I don't forget how many. I've been taking it for at least a decade, and I'm pre-diabetic because of genetic factors, and I've never experienced any abnormalities in my blood glucose, no hypoglycemia, nothing. And I take an average of 12 milligrams of astaxanthin every day. Again, I take it with a meal containing fat. Take it twice a day. I divide the dosages and never had any blood glucose problems at all. So I think that's a bunch of malarkey, as Biden would say. If you're pregnant or breastfeeding, you should avoid astaxanthin since the effects on a developing fetus are not known. They call that teratogenic effects when you take a substance that can cause birth defects. Astaxanthin may or may not be safe, but it's never been tested, so it's best to be avoided by pregnant women. The good food source of astaxanthin is salmon. A 200-gram serving of salmon has 1 to 7 milligrams of astaxanthin. The best form of salmon for astaxanthin is sockeye salmon. Smoking, when you smoke, you reduce the uptake of salmon. You reduce the uptake of astaxanthin in the body. Smokers will always have less astaxanthin in the body. So that's about it. I think it's a pretty useful supplement. I use it because of the fact, again, for two reasons. I use it because it seems to get through the blood-brain barrier. I'm hoping that it'll prevent oxidation in my brain that'll eventually lead to brain disease. I also use it because I do stare at. I spend a lot of time looking at computers in preparation of my Applied Metabolics newsletter. I read a ton of research, and I do a ton of writing all the time. So I'm looking at computers quite a bit, and I use astaxanthin to help me decrease some of the eye fatigue that would normally result. So that's about it. If you want more information on nutrition, exercise science, hormonal therapy, anti-aging research you can use today, fat loss techniques that really work, hormonal therapy, ergogenic aids, women's health and fitness, subscribe today to my Applied Metabolics newsletter, www.appliedmetabolics.com. When you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise science, general health, and medicine. And I should tell you, Applied Metabolics is 40 to 50 pages each month. I mean, it's the best bargain you'll ever find anywhere. I mean, for the price, it costs less than a cup of coffee at one of these coffee shops, and you're getting a ton of useful information with no ads. I'm not pushing any products on you. It will change your life. Just to give you an example, I think in the 4th issue, I had an article based on new research from UCLA on how to reverse Alzheimer's disease in the early stages. In other words, how you can actually reverse all the symptoms of Alzheimer's. Another article provided a dental program utilizing 4 commercial, easily obtainable stuff, toothpaste and certain types of mouthwash, that'll just about completely eliminate dental problems, including cavities and gum disease. This is what I'm talking about, life-changing. And of course, just the nutrition stuff is huge. And also, I'll expose all the myths and junk that you read on the internet. It's one of the main reasons I publish this newsletter, because all the garbage and bullshit that's appearing on various blogs and websites is just absolute nonsense. I mean, the internet's been a great innovation, don't get me wrong, but the problem is, it's like the frontier. Anybody could write anything, anyone could post any YouTube videos, say whatever they want. And unfortunately, if they throw a couple of technical terms in, people that don't have a science background or the knowledge of the subject will believe these people and could possibly hurt themselves. Particularly egregious in this regard are the videos having to do with steroids, which just turns my stomach. Some of the things that these guys say, it's just nauseating. There's one guy in particular, and I won't get into it. I don't want to, but let me put it this way. I won't watch any of those things. It's all absolute garbage. Steroid videos, they're all garbage. All of them. Trust me on that. They're all bullshit. But anyway, that's about it. Again, subscribe today, Applied Metabolics, www.appliedmetabolics.com. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. Thank you for listening.